Hello, my name is Michael Munoz. I'm a mechanical engineering student, and I decided to do my project on the medical applications of nanotechnology. To begin, I want to discuss the history regarding nanotechnology. The idea of nanotechnology was first introduced by an American theoretical physicist, Dr. Richard Feynman, when he gave a lecture at Caltech on December 29, 1959. The lecture discussed on the possibility of manipulation of atoms and is known as "there is plenty room at the bottom." Even if you just discussed the possibility of nanotechnology, this lecture provided a gateway to new ideas. One of the first advances in the field came in 1981 when Gerard Binning and Henrik Rohr developed the scanning tunneling microscope, which allowed for imaging of surfaces at the atomic level. Nanotechnology has no limit when it comes to its applications. It can be applied to renewable energy, transportation, the environment, and that's just to name a few. Today I will discuss the advances of nanotechnology in medicine. The reason I chose the medical applications of nanotechnology was because I believe as engineers, our goal is to create and improve technology for the betterment of society. And what better way than to help everyone in society have a longer and healthier life? The current research and developments for medicine are focused on helping diagnose patients, drug applications, surgeries, medical robots, and research. Early diagnosis means a lot when it comes to patient care. This allows for early treatment that can prevent the development of disease. Researchers are developing a nanoparticle intended to make early detection of cancer tumors easier. When the nanoparticle attaches to a cancer tumor, they release biomarkers. These biomarkers are called peptides. The idea is that since each nanoparticle will carry several peptides, these peptides will concentrate onto the cancer tumor, and then this will allow for early detection of the disease. There is also research in magnetic nanoparticles. The specific nanotechnology is for early detection of brain cancers cells specifically. The way it works is that the nanoparticle attaches to the microvesicle. Viruses and bacteria are also being treated with nanotechnology. The silver nanorods are in development to separate viruses, bacteria, and other microscopic components from the blood samples. This decreases the detection time to less than an hour. Iron oxide nanoparticles are used to help in imaging. The nanoparticle binds to a cancer tumor when administered. In return, the magnetic properties of the particle then enhance the images from the MRI, which will allow for a better view. With nanotechnology, surgeries are made easier. It provides an instrument for precise and accurate surgeries, only targeting specific areas that need to have work done. This gives us a method to avoid damaging any other body parts in the process, and making the recovery time faster. Nano cameras are being produced to provide a better visual for hard-to-reach places to ensure the safety of the patient and the success of the surgery. Possible outcomes of nanotechnology in surgery can be that maybe one day work can be done on the tissue and on the genetic and cellular levels as well. Nanorobots are used in other fields of nanotechnology. But the possibility of using nanorobots in medicine would be great. As discussed before, early diagnosis of conditions will be made possible with microrobots. Target drug delivery is something that's being worked on to deliver a drug or medication directly to a specific cell or target a virus. Chemotherapy, for example, is something that would benefit from nanotechnology because it would allow for the medication to be delivered only to the cancer cells. This would avoid the awful side effects to the rest of the body. With nanotechnology, monitoring of diabetes and other conditions such as hypertension can be done to ensure that the patient is always stable. Even maybe one day, nanorobots can perform the task at a cellular level. Nanotechnology will be vital in all aspects of technological advances, but the advances made in the medical field will mean that people will be able to live longer and healthier lives. Hopefully the advances will be able to be seen in our lifetime, as so much research and money is being put towards nanotechnology. Thank you.